Hey, everybody. Welcome to 7 Minute Health Chat with Robin and Kim. So, today we couldn't let February go by without talking about heart awareness because this is Heart Awareness Month. So, we had so many subjects that we wanted to talk about that this kind of went last, but we definitely didn't want to forget it. So, just a couple things that I'll start out with are cardiovascular disease is the number one killer of women and men. And I have the statistic for women, it's 1 in 3 deaths each year. And the one thing about it is most of it can be prevented. And Kim and I are going to give you some ideas on how that can be prevented. Let me put my glasses on because I'm going to read my notes here. First thing that I want to let everybody know is, and maybe you don't know it, maybe you do. I did not know this, but CVS offers a free screening. And all you have to do is you can go to their Minute Clinic, or you can do it online and sign up for this screening, and it's at no cost, and you can learn what your numbers are. And some people don't even know like what their numbers are and what their risks are, but I'm going to give you some of those risks.
And there's
some
a CVS
of those
everywhere.
Oh
CVS
gosh,
is
yeah.
all over the place.
And not every CVS participates, but you have to check and see which one does. So here are some of the signs and symptoms of a heart attack. So uncomfortable pressure, squeezing, fullness, or pain in the center of your chest that lasts more than a few minutes, pain or discomfort in one or both arms, shortness of breath, other signs such as breaking out in a cold sweat, nausea, or lightheadedness. And as with men, women's most common heart attack is chest pain or discomfort. And then I'll add to that too. You can have pain in your jaw and in your back as well. And then also always be aware of the signs of or symptoms of stroke, because guys, if you don't catch that right off the bat, it can be fatal. Stroke is serious.
And Robin, I've read too that it's harder for women to think they're having a heart attack. It's not on their radar, and their symptoms aren't quite as intense as men. So that's another thing. And women think, oh, it's nothing. It's just a flesh wound,
Right, because I've heard other people say like that have had it say, oh, I thought I had gas, or whatever.
Or indigestion, or
Right. Okay, so stroke is sudden numbness or weakness of the face, arm, leg, especially on one side, sudden confusion, trouble speaking or understanding, sudden trouble seeing or blurred vision in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause, which, that's all stroke. So that's kind of scary because like who hasn't had a headache come on in your so just be vigilant. Like if it doesn't go away, don't say, oh, it's just this. I mean, have it checked out.
Wow. I didn't realize headache was one of them.
Right?
Yeah.
Well, that's stroke. Yeah. So do you want to add on or you want me to keep on going?
Okay. I want to talk about like 5 things you can do to keep your heart healthy. Do you want to keep going what you're talking about?
No, you go for it. Go for it.
So the number one thing, and I don't think this is not on a lot of people's radar, is heart disease was not a prominent disease until when the early 1900s in our country, when we came out with soybean oil and Crisco came out, which is a trans fat, and these are in the seed oils that have been highly processed, highly used chemicals to get them to where they are usable, become very unstable. And as you cook with them, they become even more unstable. We didn't have heart disease till these oils came out, which is like crazy. And so people think it's like the bad fats or saturated fats. That's not the case. If you can Google this and you will find out the truth. There's a book called Deep Nutrition by Kate Shanahan, and she talks about this, she was the nutritionist for the LA Lakers. So she was the one who helped Kobe Bryant and the players refine their diets so they were functioned at their highest potential. Anyway, she knows a lot about nutrition. And so anyway, it's the seed oils that are in our processed foods that are used in French fries. When you go to a fast food restaurant, and most restaurants don't use quality oils, they use the cheap corn, canola, or cottonseed or safflower safflower, sunflower, soy oils. There's a hateful 8. Those are 6. And then 2 more are rice bran and grapeseed oil. Those are all oils to avoid. You want to focus on healthy fats. The healthy oils are extra virgin olive oil, avocado oil, coconut oil, MCT oil. That's not for cooking. That's more for a supplement taking,
Yeah.
which is a form
That's all
form
right.
of,
It's good to know, right?
yeah. So, but you want to make sure that you use these healthy oils. So that is one of the biggest things you can do to help your heart. Number 2 is taking care of your dental health. They found that the state of your dental, your teeth and your mouth shows what's going on with your heart too. So flossing, that's an easy thing. Everybody can floss. Yeah. Floss
I
every
love
night.
flossing. I don't know how
Yeah.
people don't floss.
You
That
do?
just-
You love it?
Oh, I do. I don't understand how
That's
people
funny.
don't floss. I don't
Well,
understand it. I'm a
and I
heavy
know-
flosser.
we were traveling and we realized we forgot our floss. And we're like, oh my God, I felt so lost. So we had to go buy floss, but it was like, but dental health
That's
is so
good.
important. It's a precursor to showing with your
Sure.
heart health. So focus on your dental health, your gum health, periodontal disease, which is your gum retraction. And I'm not a dentist, so I may not say using the right exact words, but it's something to really, it's an indicator. So be careful of taking care of your health. Getting enough sleep is a huge thing that people don't, and if you've heard the term, oh, you sleep when you're dead. Well, yeah, you're going to sleep sooner, if
Yeah.
you don't focus on sleep now. We got to prioritize sleep.
Yep.
And you know how good you feel when you get a great night's sleep. I mean, you just feel like you can take on the world. And so focusing on your sleep, it's a brain bath. And it just let your whole body kind of repair itself overnight. And so that helps to keep your heart healthy as well. Being sedentary is a huge, they did a study. I just read about this study, over 800,000 people, and they found that those who sat, who didn't do much, had a much higher incident of cardiovascular issues, and 90% of those people died. That's big.
Yeah,
So
that's
we need
huge.
to move. We need to work, and you work our heart, and whatever you do for your heart, like whatever exercise you do for your heart, cardio, HIIT, whatever, is good for your brain health as well. So it's a double whammy when you exercise.
Right.
Exercise does so much more. And for women, especially in our age, Robin, I always say we have to strength train. Number 1 is key, because strength training builds your metabolism, help bone health, muscle health, and all that. So,
Yep.
I mean, just plays a big part, and it helps your heart. So
Yeah.
don't be sedentary, get off your old behind and
Yep. And you
work out.
always, it always is hard for people like to do it, but once
Mhm.
you do it, you feel so good. So just do it.
Absolutely. And the other thing you may not think about this is avoid smoking like the plague. And that's,
Yeah.
and secondhand smoke as well.
Yeah.
That's not good for really anything. You're inhaling a
No.
toxin. It goes to every cell of your body, and it affects you, believe it or not, more than you realize. So,
Yep.
just don't be around it. Quit smoking if you're, and I know it's easier said than done.
Please. Yeah.
Get help to quit, and then, do what you need to do to not be around it. And,
But it can
that's
be
something-
done.
It can be done. Yeah.
Yeah.
So, taking care of yourself is key, and taking care of your heart. And we don't maybe not think about it. It's not top of mind because we don't see it. But, but when
You
your
feel
heart's
it.
not, you feel it. That's right. Get that heartbeat going on. So anyway, those are my tips. And do you want
Okay.
to talk about you want to read off a quick list of heart healthy foods? I know you have
Yep.
one handy.
Yep. So leafy green vegetables, spinach, kale, collard greens, well known for wealth of vitamins, minerals, and antioxidants. Berries. I have berries every single day. Avocados, Kim's favorite. Fatty fish and fish oil. Walnuts, also a brain food.
Yep.
Beans.
I
dark
eat walnuts every
chocolate.
day.
Dark
Mhm.
chocolate. We talked about dark chocolate at the first of the month.
Yep.
Tomatoes, almonds, seeds, garlic, olive oil, edamame, and green tea. Guys, green tea is so good for you.
I drink that every day too.
Yeah, I do. Well, I try to. Sometimes I drink chamomile. I've been having sleep issues, so I'm trying to drink some chamomile
Yeah.
as well. Let me see if I wanted to miss anything here. We talked about things can be managed. Like 1 in 3 women die from it, but it can be managed. Here are some risk factors that can be managed. High blood pressure. I can't stress enough, know your blood pressure numbers, know and watch them. I mean, it's so important because if you're in that high, we do blood pressure checks in around with another company that I work for. And I'm amazed every single time we do it, how high the blood pressures are. It's scary.
You said that
Scary.
before. I remember you
Yes.
talking about that. Yeah.
I'm shocked every single time. Another risk factor, smoking, high blood cholesterol, lack of regular activity, as Kim mentioned, obesity and overweight and diabetes. And you can't change these risk factors, your age, your gender, your heredity, your race, and previous stroke or heart attack, but you can make strides to not be sedentary and to eat the correct foods and stay away from harmful other foods. And another thing that we didn't really talk about is stress. Stress is huge, you guys. And we don't have a time to go into everything that I would love to go into, but in my newsletter this month, I go over stress and heart disease. Look at this page. It's huge. Things that you can do to help you through stress. And everybody has stress, but you don't want to have so much stress that it does affect your health. So I'm going to put a link to that newsletter so that you could read about it if you're interested in the comments.
And then
so
can they subscribe also? Will they be able to subscribe?
I don't have a subscription yet. I'm not that versatile with it, but I'm hoping to get there. So you can follow my Get Fit with Robin page, and I post it every month, but someday I'll get to that subscription.
Perfect. Yeah.
I need help. If anybody knows how to do that with like survey, with what is it called?
Survey
the email
Monkey?
No, not Survey
MailChimp?
Monkey.
MailChimp.
Let me know. So any other thoughts you have to add to the
just take care of your health or your heart, because being heart healthy, doing all the things that you can keep your heart healthy are key and will help you grow young instead of growing old.
For sure. And then the last thing that I'll add is for next month, Kim and I are going to change it up a little bit. We're still going to do 7-minute health chat, but we're going to make it a little more personal. So some of the subjects, and it won't be every single week, but some of the subjects we're going to talk about are things that have personally affected our lives. So like alcoholism, things that happen to you in peri and menopause that people don't like to talk about. There, I'll give you that little carrot. And if you have something in your life that's affecting you and you'd love for us to talk about it, let us know in the comments and we'll add it to our list. But we'd like to get a little more personal and a little more vulnerable for you guys.
And if you have our audience out there, if you have something like you want us to talk about anonymously, you can let us. We won't mention your name or anything.
Right. Absolutely.
But it's for if you're having an issue, somebody else is also.
Yep. And that's what we want to do. We want to spread the health, the love, and longevity.
Yeah,
right.
Exactly. Yep, absolutely.
All right.
Thanks, Robin.
Have a great day. Oh, right. I almost lift my arm.
That's
up.
right.
Look.
That's good.
Look, I'm so excited.
You got it. Yeah. Perfect.
All right. Have a great day, everybody.
All right. Bye-bye.
Bye.